February 4th was World Cancer Day, but like we do say, one day is never sufficient to talk about cancer or perhaps have an advocacy on cancer. And that's why this morning we're stepping up advocacy on cancer awareness in Nigeria. And we're doing that from someone who's been there, who's been trying to make things better for lots of people. I'm going to be speaking with a nurse who cares for those, that are down with cancer. Now I'm talking about Nurse Adejimoke Oshoja. All right. She's a senior nursing officer with the Lagos State University Teaching Hospital, LASUT. And I can tell you, she's made lots of inroads in this direction. She was decorated as a leader and a true pioneer in the field of oncology nursing. She made history in 2025 as the first ever recipient of the DAISY International Award for Extraordinary Nurses in Oncology in Nigeria. And she was also further recognized as a fellow of the Academy of Oncology Nursing. I can tell you that our clinical, of course, talking about our clinical excellence, is unmatched, as evidenced by her recent Best Clinical Nurse Award, which she received from the Lagos State University Teaching Hospital. So there's a whole lot, to really make reference to this morning. So let me bring out to the microphone right away. Nurse Adejimoke Oshoja, it's nice having you in the building. Good morning.
Good morning, sir.
And you're welcome to Traffic Radio. Thank
you very much.
All right. So as a very, I'm looking from your resume right now, very, very rich indeed. And I can tell you, your exploits in this oncology nursing is heroic. And most prominent is your award of the DAISY International Award for Extraordinary Nurses in Nigeria in oncology. Talk to me. Which award is that?
It's an international award.
Okay.
Prepared for nurses that are working in oncology department.
Okay. And you won it for 2025?
2025, yes. December 18th.
Wow. So congratulations.
It was organized by Oncology Nursing Society of Nigeria.
Right. So how has it been for you? I mean, where did you join, or at what point did you decide to join nursing?
That was 2019.
2019 or
2019, sorry.
Okay.
2019.
2019.
November, yes.
Wow. So that's like 5 or 6 years down the line?
Yes.
So how has it been for you as an oncology nurse?
Pretty good. Sometimes good news, sometimes
bad news.
Yes.
Right. Even though we do not want to dwell on bad news, but there's something about nurses that, makes you guys stand out in terms of hospitality.
Okay.
Right. Talk to us about what does it take to become a nurse, really?
To become a nurse is a calling. It's not just you wake up one day you want to be a nurse. It's a calling. There are some quality that you have to possess to become a nurse. You have to be empathic.
Right.
You have to give in your best, holistic treatment to your patient and people around you. Not only your patient, but people around you too.
So all these qualities must be put together.
Yes, sir.
If one wants to become a better nurse.
Yeah.
Right. And you've been doing this for, you said, since 2019?
Yes, sir.
So
as an oncology nurse.
Yeah. So the ops now, in terms of the prospects now, the ops are that you go there regularly. There's a routine you go through. And each day you see your patients, you feel happy.
Yes, sometimes. Most times. Happy. Yes.
All right. Other times, things might not go the way it should be.
Yes. Because when you are expecting your patient, they are looking at a patient that this person is doing pretty well. And as cancer, we have it takes your patient away from you. It's sadness.
It's very sad.
Yes.
Now, being an oncology nurse,
yes,
it brings a whole lot of responsibility on you, right?
A lot.
How different is it from being a normal nurse?
Oncology is a specialty field.
All right. Okay. I need to get closer to that microphone.
Okay, sir.
All right.
Are we good?
Yes, go ahead.
Okay. So for you to be an oncology nurse in that specialty, you have to be a nurse. Whether you have to be a nurse registered with Nursing and Midwifery Council of Nigeria before you possess your specialty, which I choose oncology.
Okay.
So many people were concerned why oncology. I don't want to say it on speaker. Most people out there think of oncology. Let me say, they said, "Oh, why are you caring for patients about to die?" So I told them, if I can have my way, I can change things. So I was working with one doctor. I don't want to mention her name. So I purchased a form of on nephrology. So I give it to her to help me sign and serve as reference. Oh, she now said, Oshuja, why do you want to go on this? I know your quality. I know what you can do. Why don't you go for oncology? You will excel. Your patients will like you. And to God be the glory. I changed my form into oncology.
So,
and I'm doing
so this person more or less like your mentor?
Yes, sir.
Wow. And that's how you started. Ever since, you've not looked back
at all.
Okay, let's look at you have something. It's called Behind Exceeding Care Cancer Platform.
Yes, sir.
Talk to me. What kind of platform is that?
It's a platform. I told you when I joined LASUT in 2022.
All right.
So I met a patient. I have to study the environment and all that. So I heard when a nurse was educate patient the effect of chemotherapy. So we left. We exchanged numbers with the patient. Okay, I met the patient at the gate. Said, let me drop you closer to your box up. So we exchanged numbers. So a week after, the man called me that his wife is very weak. And what happened? He said the wife is stooling and vomiting for the past 1 week. What are you waiting for? I heard the nurse telling you that once there is vomiting,
bring the patient.
Bring them to the hospital. Go to the nearest hospital. Go to, if LASUT is far away from you, go to the nearest government hospital, or if primary health care closer to your place, let them stabilize you before coming to the hospital. The husband told me that they are waiting for their next clinic day before coming.
Wow.
So we lost that woman. So I was down that day. What happened? I can hear the nurse clearly telling them what they can do at home before coming to the hospital. Right. So and I'll decide how can I help these people. So that is how Exceeding Care come on board. Exceeding Care is a cancer support platform. It's not an NGO. We are starting with platform where we educate patients on possible side effects of chemotherapy, a place where they can reach before going to the hospitals. That platform, we have oncology nurses across Nigeria. Not only
how many oncology nurses do you have
in that platform? We are like 8 in that platform. Yes, we have from the far north, we have from the central north, we have from the east, and we have from the west.
Wow.
So then we have pharmacists on that platform. So patient there is a platform for them to reach. And I tell you, let me tell you one scenario. A lady was vomiting and stooling at the same time. So she used her medication. There is no response. She dropped the voice note on that platform. This is what I'm experiencing. Before any nurse could assess the people that have been on that journey, they told her, okay, buy ORS, quickly go to the nearest hospital, be close to you, be stabilized. And she did that. Once she's stabilized, they refer her back to LASUT, where she received her full treatment, and she's fine.
Which is very, very good.
Very.
I must say, well done for all of this that you are doing.
Thank you.
But I'm hearing that you have a fitness aerobics
section. Yes, sir.
When is that?
That's on Thursday, 26th February. 2026.
That's more or less like 2 weeks from now.
Yes, sir.
All right. And where will that be taking place?
In LASUT at Elo Lagos Field.
Okay, LASUT there.
Yes, sir.
So you're calling on people to join this work.
Yes, sir.
And also
support.
Yes. Okay, so for those who are listening and would like to support, what can they do? How can they do that?
We are inviting students. Last year, I went to some schools to educate them on breast cancer awareness. Hold and behold, most children collect my number. Their parents, it's like those children notice that their parents have one lump or the other in their body system, and their mother has been managing it, and there's no. So some of the mother calls me that my daughter gave me your number. I need your advice on the old and behold is cancerous.
Wow.
Which I help them with their journey. Some are still taking their treatment. Some are still fair. They are still at home. Now, they said it's not my portion. That is what people say, but God did not say. Like 2 days ago, I was talking to one patient. I don't know how she got my number. She sent some picture to me that some say is cancerous, but God didn't say. And she even sang a song for me.
Wow.
Ayé ló sọ pé mi lè níláárí.
Wow.
Ènìyàn ló sọ pọ́rọ̀ mi kò lè jásíre. Wòlíì ló sọ páyé mi kò lè nítumọ̀ o. kíyèsí ọlọ́run kò sọ bẹ́ẹ̀. That's what she told me.
Wow.
And I educated man, you don't have to stay at home. That is the problem you are having with our people staying at home, believing in church. I'm a Christian, I believe in miracle also, but you have to take your medication. Right. The two has to go. The two has to balance each other.
All right. So 26. You say people should come around.
Yes, sir.
Okay. So let's say
8 a.m.
Right.
to 9:30 a.m.
Okay. Nice having you in the building. For those who want to connect with you after this, how can they do that?
They can reach me on my number. Can I drop it?
Yes. Go ahead.
070.
Right.
62 64 6646.
That's 070 62.
Yes, sir. 64
64
66
66
46. Adejumoke Oshoja.
Adejimoke Oshoja, nice having you in the building.
Thank you so much.
And I wish you more in terms of successes, especially as you continue to care for humanity and take that to the next level.
Thank you so much.
Thank you so much for being here.
Thank you.
All right, a brief break. When we return, we'll do our birthdays before we switch gears to talk archaeology.